probably the most common wrinkle that everyone encounters. Even just frowning causes a crease to appear here. It's actually quite hard to get rid of. Many people think that exercises are ineffective and have become disappointed with them, so they end up getting Botox injections. Let's figure out in this episode whether that's really the case and what tools can actually help solve this problem. And I'll also show you an effective exercise at the end. A glabellar wrinkle can appear as early as adolescence and is linked to certain psychological patterns. It often gives the face a displeased expression. Many people feel put off when they see someone with a pronounced frown line between their eyebrows. That's because of physiognomy. It's a sign of being sullen, angry, or dissatisfied. And as a result, women who already have a noticeable frown line start to wonder what they can do about it. They start using cosmetics, begin doing facial massages and exercises, things that honestly many people believe don't really help. And then in the end, they go to a cosmetologist and get Botox. Of course, that's the easiest way, but you need to understand that Botox, it's a very powerful organic neurotoxin that gets into the muscles and blocks their connection to the brain. In this episode, I want to tell you about the deeper reasons why the frown line appears. Once you know this, you simply won't ever need Botox. First of all, the reason. Of course, it's an emotional pattern. You need to pay attention to your emotions that create frowning or anger. This helps. But if you look at it from a biomechanical point of view, why does the frown line appear? Take a look at the skull. The frown line. It's located right here, between the two eyebrows. This is the area of the metopic suture. During fetal development, when the skull is forming, the frontal bone consists of two bones. As the child or fetus develops and evolves, this suture begins to ossify. But at the same time, it connects the two parts of the frontal bone, and tension is concentrated there. So this is a suture, a fused suture. That's why there will already be increased tension in this area, in the center. And that's exactly along this line of the metopic suture, the frown line forms. The next important point is that if we look inside the skull, there is a structure called the crista galli of the ethmoid bone. Very strong ligaments attach here, let's say of the brain, that divide the right and left hemispheres in half. And this large ligament, which is also called the falx cerebri of the dura mater, stretches like a bowstring. So there is strong tension here. In other words, the falx cerebri is under significant tension. This leads to tension running through the entire brain toward the glabella, the area between the eyebrows. And it starts at the back of the head, right from the foramen magnum, from this area. And of course, this tension extends into the spinal canal. You might be surprised, but the glabellar line, frown line, can actually form. Even if you have issues with your coccyx or sacrum. How does this happen mechanically? A blockage or problem arises here. Inside the spinal canal is the spinal cord. And there are also the brain membranes there. And one of the densest of these membranes is the dura mater. It's basically a fascia, like a ligament, a long ligament. If a blockage occurs here, then all the structures along the entire spine get pulled tight. Through the neck, through the back of the head. And then the tension continues through the falx cerebri, right here. Can you imagine? So, from your tailbone all the way to your nose, it's all one single structure. That's why, even if your nose is stuffy, the reason your nose is blocked might not be in your nose at all. It's the same with the area between your eyebrows. If there's significant tension inside the skull, this area here will automatically tense up too. No matter what you do, this crease, the frown line between your eyebrows, can be easily removed if you just work with the frontal bone. In other words, if you get rid of this tension inside the skull and relax the frontal bone. That's exactly why simple techniques that focus only on stroking this area, which, by the way, I demonstrate myself, actually do work. They provide a short-term effect. They can even reprogram your emotional patterns so you don't frown. But if you have something stuck inside your skull, especially in the frontal bone, if you have a pronounced tension block, then the skin here will automatically wrinkle. That's just how it works. Wherever there's tension in the bones, the skin starts to contract and wrinkle. It becomes rougher, less mobile, and less elastic. This is very clearly seen even in osteopathy. There's a skin test. You can even just slide your hand like this along the spine. So if I have a person stand here and I slide my hand along their spine, just like that. And where? Where my finger gets stuck, where I feel increased skin rigidity. That's usually where there's a vertebral motor block in the spine. The skin there also becomes denser, swells up, stagnation develops, swelling, and so on. Something similar happens in the area between the eyebrows. Of course, there isn't a pronounced layer of subcutaneous fat there, but the skin just starts to crease. Friends, if you want to smooth out frown lines, facial wrinkles, tighten your face, and generally look 5 years younger, then I invite you to join my program. So let's move on to the techniques. The first technique will be focused on working with the frontal bone. This is a subtle technique, and it might not work for everyone, but I still decided to show it. What do you need to do? First, you need to place one hand on your forehead. The contact should be very gentle, very delicate, and try to feel your entire forehead in volume through your hand. In other words, establish contact. Imagine that all the tissues are alive. You can interact and communicate with them. So, establish this kind of contact, a dialogue. Next, place your other hand on top of the first one. The first hand creates the contact, and the second adds extra weight and volume. Close your eyes. You'll feel as if the bone starts to dissolve. As if the back of your head and your forehead become more pliable, more fluid. But at the same time, some areas might feel denser. Just give your forehead the command to relax. You might notice that some areas are denser. Ask yourself, in which direction would your forehead and the bone like to shift with your hands? You might feel a tendency to shift in a certain direction, and your attention and your fingers will start to move. It could be downward, to the left, to the right, anywhere. It doesn't matter. Just learn to interact. It's like a dance where you interact with the structure and follow its lead. One of the principles of stereotypical work is that when you make contact with the tissues, they guide you and you follow the tension. And as you keep following the movement, the tissues will start to relax, and as a result, your forehead will feel lighter and more airy. Next, we move on to working with the metopic suture. It's a simple technique. Watch closely. Break your palm. You place it right on the glabella, like this, and you start the process. So, you pull upward as if lifting the frontal bone, and you start making this kind of vibrating motion. So your goal is to sort of pull the frontal bone away from the bridge of the nose. And this technique is very effective. So are you doing it too? 1 to 2 minutes. And then there's a more superficial technique for the corrugator supercilii muscle, the one that tenses when you frown. You grab it, start vibrating, and you can even add a touch of that frowning expression. Catch it, grab it, like you're catching that emotion by the tail. And then you focus on it, keep vibrating, then do a little tap and inhale. And on the exhale, you release that tension. And these techniques really do help smooth out the area between the eyebrows. Of course, there are also deeper techniques that require comprehensive work with the entire skull. But I guarantee you, if you set a goal to smooth out the area between your eyebrows in a natural way without any Botox, I guarantee it's possible. The thing is, you need to acquire these special skills. You need to develop sensitivity. You need to learn how to interact with your body. And you'll be able to easily control the area between your eyebrows, as well as the overall state of your body. All of this is possible. Like, subscribe, and be sure to truly express your valuable feelings with us after trying out these effective techniques and also sharing your thoughts.